Welcome back to Growing Young. I am Al Judge, an engineer applying failure analysis to human health and the medical industry. Over the past two episodes, we've broken down the mechanical failures of the cholesterol myth and statin drugs. But today, we are going to look at the biggest systemic failure of all, the medical research itself. What if the very studies your doctor relies on to prescribe your medications are fundamentally flawed? To understand the scope of this problem, we need to look at the work of Dr. John P.A. Ioannidis. Dr. Ioannidis is a professor of medicine, epidemiology, and biomedical data science at Stanford University. He is one of the most cited research scientists in human history, with hundreds of thousands of citations to his name. He specializes in meta-research, which is essentially applying failure analysis to scientific research itself to see if the studies actually hold up. In a landmark paper titled How to Survive the Medical Misinformation Mess, Dr. Ioannidis and his co-authors outline 4 devastating problems with modern medical care. Let's break them down. The first problem is that much published medical research is simply not reliable, offers no benefit, or is useless to decision makers. There are approximately 17 million human-related articles in PubMed, with nearly 1 million new articles added every single year. Yet, the quality is incredibly poor. In one survey of over 60,000 clinical studies, a meager 7% passed the criteria for high-quality methods and clinical relevancy. Because of this massive volume of bad data, an estimated 20 to 50% of all healthcare services delivered in the United States are inappropriate, which wastes resources and actively harms patients. You might think your doctor is filtering out the bad science, but problem 2 is that most healthcare professionals are completely unaware of this issue. Many doctors rely on reading just the abstracts of papers, falsely trusting that journal editors and peer reviewers have ensured the study's rigor. This leads directly into problem 3. Even if they are aware, most healthcare professionals lack the basic skills necessary to evaluate whether a medical study is actually reliable. In a pre-test given to over 500 physicians and medical professionals attending an evidence-based medicine training program, an astonishing 70% failed a simple 3-question critical appraisal test. Even among those who reported feeling confident in their ability to evaluate medical literature, 72% still failed the test. Because doctors cannot properly appraise the science, deadly mistakes happen. For example, during the trials for the painkiller Vioxx, evidence of a 4-fold increased risk of heart attacks was plainly available in the study data. But the researchers spun the data. Peer reviewers and prestigious medical journals accepted their spurious arguments without evidence, and millions of prescriptions were written before the drug was finally pulled from the market after causing cardiovascular deaths. The final problem in this misinformation mess is that patients are left without accurate evidence or skilled guidance when making medical decisions. The popular media constantly bombards us with medical stories that fail to meet accuracy criteria, often wildly exaggerating the benefits of a drug while minimizing its harms. Because the research is flawed, the doctors are too busy or untrained to critically appraise it, and the media is exaggerating it. The concept of shared decision-making between doctor and patient completely breaks down. Patients end up blindly trusting a broken system. As an engineer, my advice is simple. You cannot blindly trust a headline or a prescription pad. You must question the narrative and take control of your own metabolic health. Speaking of questioning the narrative, in episode 4 of our Medical Misinformation series, we are going to tackle another massive dietary myth: salt. We are going to look at why salt is rarely the villain it's made out to be, and why, especially if you follow a low-carb or carnivore diet, your body actually needs a lot more of it than you think. If you found this failure analysis helpful, please subscribe, and I will see you in the next video. Keep growing young.